Hey there, it's John again. If you're new here, welcome to the club that nobody has to join. We don't have fancy jackets, but we have hospital gowns with awkward ties and more doctor's appointments than a medical drama. Let's talk bladder cancer. Not exactly dinner table conversation, I know. But if you find yourself Googling, why is there blood in my pee at 2 a.m., then congratulations. You've already dipped your toe in a delightful world. So what is it? Bladder cancer happens when the cells in your bladder go rogue and start multiplying like a rabbit at a carrot convention. Most of the time, it starts out in the urothelial cells. Urothelial cells, say that 5 times fast, which lines the inside of your bladder. That's the organ that stores your pee. Are there different types, different flavors? Well, yes, there are. The most common is urothelial carcinoma, which sounds fancy, but it means cancer where your pee touches. And then you've got squamous cell and adreno, which are rare, but like to crash the party now and then as well. Some common symptoms, aka the things that make you go, blood in your urine. Pro tip, your pee should never look like Cabernet. Peeing way too often, especially when you're nowhere near a bathroom, and burning when you go. And some back or pelvic pain. Usually that's the later stage. If any of these things sound familiar, it's worth getting it checked out. Even if you're too busy or don't like doctors, you gotta get it checked out. Don't wait. Trust me, I get it. No one likes doctors when they're holding a scope, but you gotta do it. So, who is most at risk? Smokers, because your bladder ends up processing all those toxic chemicals. People exposed to industrial chemicals like hairdressers, painters, shipyard workers, or anyone who's ever been in the don't inhale this warning on their job site. And men, we're 3 to 4 times more likely, yay. Folks over 55, yay, because everything gets more exciting with age, right? How do they find it? Well, pee test, urinalysis, cytology, and cystoscopy. Yes, cystoscopy. A tiny camera, it goes up your, well, you know what. It's not fun, but yeah. And imaging tests like CT scans, MRIs, ultrasounds, you get the works. And then what? Well, that depends. If it's non-muscle invasive, you might get treatments directly into your bladder like BCG. Kind of sounds like punk band, right? But if it's muscle invasive, and that's kind of my story, you may face surgery, chemo, radiation. And if it's metastatic, well, the doctors go into full battle mode. The good news? Catching it early makes a huge difference. The survival rate is high when treated early. But it's the kind of cancer that likes to come back and say, remember me? So you'll be keeping in touch with your urologist for a while. Yay, a new bestie. Hey, bottom line, bladder cancer isn't something most people think about until they have to. But once you're in it, you learn fast. These tests, the treatments, the acronyms, it's a crash course in a topic nobody wanted to major in. But hey, here we are. And you're not alone. Whether you're just starting out, mid-treatment, or 5 years deep in follow-ups, there's room here for you. And hopefully a few laughs along the way. As always, though I may look like a doctor, the content in this video is not intended to be taken as medical advice and should not replace the recommendations and advice of your doctor. Please like and subscribe and share with anyone going on this journey or a loved one who wants to learn more. Until next time, be well.